Hello, I'm Dr. Eric Harmelin. I'm the owner and medical director of Annapolis Foot and Ankle Center, located in Annapolis, Maryland. Heel pain affects approximately 2 million Americans every year and is one of the most common conditions we treat in our practice. There are several potential causes of heel pain. However, by far the most common cause of heel pain is a condition called plantar fasciitis. This is an inflammation of the plantar fascia, which is a band of connective tissue on the bottom of the foot, which runs from the heel to the ball of the foot, commonly caused by overstretching. This overstretching can be a result of obesity, abnormal walking style, ill-fitting shoes, and running and jumping on hard surfaces. Deformities like flat foot are an extremely common cause of plantar fasciitis because the ligament is forced to overstretch as the foot spreads out and the arch flattens. In many cases, plantar fasciitis is associated with a heel spur. The plantar fascia tears and bleeds at the heel, and over time, these injuries calcify and form a bony growth. However, the heel spur is not actually what causes the pain. It is the inflammation of the plantar fascia itself which causes the pain. Most commonly, patients experience pain after a period of rest, such as when stepping out of bed in the morning. Often the pain will improve after walking for a while, but not always. The average patient takes roughly 12 weeks of treatment to resolve this condition, but better than 95% of patients get better without surgery. Treatment may include a program of stretching, orthotics, anti-inflammatory medication, steroid injections, ice packs, shoe gear changes, a splint that is worn at night, as well as laser therapy. In the small percentage of cases that do not respond to conservative therapy, surgical intervention may be indicated. In this procedure, a scope is inserted into the heel through a very small incision. The portion of the plantar fascia that is responsible for the pain is cut and released. This is a quick 10-minute procedure performed under light sedation, and patients are able to bear weight immediately. Other causes of heel pain include Sever's disease, as well as bursitis or a heel spur at the back of the heel where the Achilles tendon attaches. Sever's disease occurs in children ages 8 to 16. It results from stress placed on the growth plate of the heel bone. An excessive amount of running or jumping causes inflammation to the growth plate, which results in heel pain. Treatment usually includes stretching of the calf muscles, rest, ice, and heel lifts. If you're experiencing heel pain, don't continue to suffer. We can help. Call us or visit our website for an appointment. Let us get you back on your feet today.